Bismillahirrahmanirrahim. Respected Naib Amisa, panelists, dear friends and colleagues, Assalamu alaikum wa rahmatullahi wa barakatuh. It's a great honor and privilege to be among friends and colleagues. I'm grateful to Dr. Fizan for extending this invitation. I know him and his team has worked incredibly hard to organize this meeting and to get everyone together to start the discussion. And I can see the discussions are happening, there are different ideas coming, and that's what is required. And I'm also grateful to Dr. Fizan's team for putting up with me with all the slides and everything. All these slides were made by my son, so if there's anything wrong, it's him to be blamed. We as surgeons always want to blame somebody, so he's the one to be blamed. So I'm sure you're all aware of what I'm going to talk about today. You probably know, but I'll just say it anyway. My agenda is a little bit different, so you'll know that at the end. We look at, I will just go through wudu, fasting, hand washing, and few hadiths that we all know, and see if there's any medical relevance to it. And I'm sure you know the medical relevance, but let me just go through it again today. Wudu, ablution. We say that Islam is 1400 years old, it's an orthodox religion, but is it really? We do this wudu 5 times a day for the last 1400 years. So what do? We actually wash our hands, wash our arms, rinse our nose, mouth, clean our head, and then of course wash our feet as well. You would be surprised to know that one of the most difficult infections to treat is MRSA if somebody is unwell and that harbors a nose. And this is only in the last 15, 20 years that we know. And I don't know whether this will run or not. I think probably it's not going to run. If you look at the most clean thing that modern medicine has to offer is when you're doing surgery. This is my senior sister. She's about to scrub for me to do a cancer resection, and she's going to wash her hands. She's going to wash her arms till her elbow, and she's going to let the water run from her hands down as we do. She's not going to rinse her mouth or nose, but she's wearing a scarf. She's not going to wash her head, but look at her. Her head is all covered. So these are all evidence-based things that we have been doing for the last 1400 years. So it's not an orthodox religion after all. I just saw an advert in one of the magazines saying this is the 17th year of WHO celebrating hand washing. 5th of May, if you want to know it, is the day that they actually do it. 17 years. We've only been doing it for the last 1400 years. I mean, they call Islam an orthodox religion. And then one of the, I think it was a news journalist who actually asked Hazur very cheekily that why do you have to do different things with different hands, referring to Taharat. And what Hazur said to him, that when we shook hand, you had all the confidence that my right hand is clean, but I didn't. And after that, he would never ask that question again to Hazur or anyone else. So, hand washing, simple thing, but look at the evidence. If you go into the ward now, especially after COVID, every ward, every place, and I'm sure it's the same here, wash your hands, wash your hands. They never realized how important this hand washing is till something happened and then they do it. But we have been doing it for a little bit longer than they think. fasting. Again, 1400 years old thing. It has got all the advantages that we know of. When West couldn't actually control obesity, diabetes, and low-density lipoproteins and cholesterol and everything, they gave the name of time-restricted feeding. They gave it another name of intermittent fasting. This is all but fasting as we know it, as we have done it. So there's, you call it an orthodox religion, but all the commandment and instructions were there. The evidence shows that it actually reduces cardiometabolic risk factors, it reduces insulin, it increases insulin resistance. So all these things are there. But the issue that I have is that this research is not done by us. It was done by somebody else. So, in general, fasting does all these good things. So, you call it time-restricted eating, you call it intermittent fasting, but it is the fasting as we understand, and that's what we have been doing. Honey. There's an hadith saying that you get cure from honey and Quran. We have heard the goodness with the Quran that we have got. The same thing goes with honey. And if Rasul Kareem Sallallahu Alaihi Wasallam has said there is cure in it. And it's a Cochrane review that says that it's actually better than few of the known anti-cough agents, especially for children. It works there. It's used as tropical ointment. So it actually works, it actually does it. So whatever you look at, you can see that it has actually got an advantage. But our problem is that we haven't looked at everything. It's only recently one of the MDs in Switzerland have started doing research under Hazuri Akhtar's guidance. So it's started, it's coming, but it's too slow. And, in radiation-induced mucositis, it actually helps. I'll just go through quickly a few other hadiths and practices that we know of. And I'm sure you're all aware of it, but I'll just try and put it down to you. Sleep on the, there's an hadith saying, don't lie flat back, just lie on the side there. If you do a continuous ECG monitoring, if you lie on your right-hand side, there is no change in the ECG as compared to other positions. So the significance we don't know, but there is a difference. There is actually an advantage in following the hadith. We have all heard that if fly falls in your drink, dip it, and then you can drink it. And studies have shown that there is an antimicrobial peptides that are released from the body of the bee that actually is protective for you, and hence you can actually drink that. Imagine, this was told 1400 years back. And have we got an answer to this? Does Islam offer any help on this matter? Yes, it does. There is a hadith saying that if you chew properly, that food will be used, and that gulp down is not any help to you, asking you to slow down to eat. There are different hadiths which are not substantiated. Some say chew a morsel for 17 times, 22 times, and 40, but there isn't. I couldn't find any substantiative hadiths to follow that. But what it's saying is slow down and chew your food. And what happens then? If you chew your food, this is the mechanism. I don't want to bore you with this cycle. This is the cycle how you actually stop feeding, stop eating. It's a satiety center, your center in the brain that gets stimulated when you're eating and you stop. If you eat slowly, it takes some time for these GLP-1 agonists to be released so that you actually feel full and stop eating. So if you follow this simple commandment, you're actually going to eat less. Then there's another hadith saying that fill your stomach 1/3 of food, 1/3 of water, and 1/3 of air. Essentially saying, eat 1/3 of your appetite. Now you follow these commandments, would you be fat or would you have any other thing? No, you wouldn't. I'm the one who's to be blamed, I've got my belly coming out. But these commandments are there. It's us who haven't actually followed these things that we actually suffer. Finally, I just want to pick up everyone's mind, and I'll try and see if I can get my esteemed colleagues to be convinced that that's the way forward. I saw this advert in the telly saying that if you rinse your mouth with Listerine alone, that's actually much better than either flossing or brushing teeth for bad breath. I can bet if you wash your mouth, rinse your mouth 15 times a day with simple water, there will be no bad breath. But can I say that standing here? No, I can't. There isn't a research to say that. It's a simple thing. I'm just giving this as an example that we haven't done research. And Huzuri Akhtas has actually been saying this for a while now, that you must do research. He acknowledges in the landmark speech that AMA UK was so proud to have this first international AMA meeting where he said, give us the guidance. And his guidance was to do research, make things cheap for humanity, make good things for humanity. And this is what we have not done. We have done it, but we haven't done it enough. Over half a century ago, we had a Nobel laureate. We are a living community. We have got our communication with living God. We have got Huzuri Akhtas to guide us in anything and everything. So should it take 70 years to produce an Abdus Salam? We can either wait and pray that an Abdus Salam will be born, or we can do something about it. And that's where my help from esteemed colleagues comes through. Abdus Salam, Professor Abdus Salam Sahib's father, Chaudhry Muhammad Nazir Sahib, his name was Muhammad. He was actually a head teacher in one of the schools. People asked him that when we send something for you to sign, why does it take so long to just sign your name? And they realized afterward that every time he will sign Muhammad, he would say Durood. And this is the message that should come out. That we need to, if we can't do anything else, this is the present that we need to give to our children. Get them into a habit of doing that. And once they get this into habit, then we need to do the mentoring. We can't just rely on prayers. We have to do something physically. And the most important thing is to do the mentoring. I see there's actually mentoring happening here. But mentoring, as we know, consultants, is, yes, you should do this, you should do that. That's not going to take us anywhere. For the last 70 years, that hasn't taken us anywhere. What I mean by mentoring, and I'll finish the Chairman Sahib, is that a 55-year-old or 60-year-old mentor needs to take a 20 or 25-year-old and transfer his skills, knowledge, and attitude into that by the time he reaches 25. That's the only way we will have Abdus Salam. Now you can imagine a 25-year-old with the knowledge, skill, and attitude of a 55-year-old, his daily day-to-day routine will be, he could do it with eyes closed. He'll have time to think, to go forward, and to produce Abdul Salam. And I'm sure, inshallah, we wouldn't have to wait for Abdul Salam. They will be born through this sort of meeting and collaboration. And we have talked about multidisciplinary team meeting, collaboration, mentoring. That's all what's required. And I'm sure, inshallah, we'll make them. Jazakallah.